Good evening and welcome to Doctors on Call. I'm Dr. Alan Johns from the Department of Family Medicine and Biobehavioral Health at the University of Minnesota Medical School Duluth, and I'll be your host for the program tonight on cholesterol problems. What would you like to know about the diagnosis and treatment of cholesterol-related problems? We'll be taking your questions at 218-788-2844 or toll free at 1-877-307-8762. I'm pleased to introduce our panel of medical experts. Dr. James Konoff is a family medicine physician at the Duluth Family Medicine Clinic. Dr. Victoria Heron is a family medicine physician with the Rader Clinic in Cloquet. And Dr. Jason Wall is a family medicine physician with the Duluth Family Medicine Clinic. Our medical students answering phones tonight are Brandy Bolig from Sartell, Minnesota, Luke Logering of Crookston, Minnesota, and Sarah Reyna of Britt, Minnesota. And now on to tonight's program on cholesterol problems. Well, Dr. Wall, let's start out with just the basics. Well, what is cholesterol, and is it something we need?
Well, thank you, Dr. Johns. Cholesterol is a waxy, fat-like substance that is essential to life. It's in every animal cell wall, and is integral part of our nervous system and daily function of our bodies. But like most things in life, too much of a good thing can be a problem, and that's what we're here to talk about tonight.
Great. Well, Dr. Heron, so it can be a problem. What problems do excessive cholesterol cause?
Well, the most common problem excessive cholesterol causes is when it builds up in your arteries and causes plaque. If you get too much plaque, it can actually close off an artery. Closed artery, no blood flow, maybe heart attack, maybe stroke, maybe no blood to your leg, and then your leg dies. It can be a place where a blood clot forms all of a sudden. And then again, you go from some cholesterol buildup, and then all of a sudden, you have a rough place and a clot forms, and then you drop dead. That's a bad thing.
That's a bad thing. So maybe I can ask you a follow-up question. And is this a problem with the arteries or the veins, or both?
Mostly a problem with the arteries.
Okay.
That's what we worry about the most.
Okay. Well, thank you. Dr. Konoff, so what kinds of, cholesterol, there's different types, right?
Mm-hmm. Yeah. So cholesterol, right, it's kind of an umbrella term that we use to talk about lots of, or several different things that we kind of measure in your blood. And so we're talking about cholesterol as a bad thing, and in general, when we talk about cholesterol, that's what we mean, but it actually, there are several different kinds. There's a kind called LDL, commonly measured, which is a low-density form of cholesterol. That's really what we call the bad cholesterol. There's also HDL, high-density cholesterol, which actually is associated with better health outcomes. So it tends to be that if you have high HDL, that's a good thing, whereas high LDL, that's a bad thing. So it's a little bit more complicated than just all bad.
Sure. Well, thank you. Are there other kinds of lipids too, Dr. Wall?
Certainly, triglycerides, and there are your regular fats in your diet that are broken down into other, but triglycerides would be another fat-like compound that we measure, and that is of interest for people that some people have genetic predispositions to having extremely high triglycerides, and we know that those are associated with poor health outcomes.
And that's an interesting question too. So, Dr. Heron, genetics enters into this, right? Is it in your family? If there's high cholesterol in your family, does that make it more likely you may have it?
Unfortunately, extremely so. You can have the best diet in the world, you can follow a wonderful exercise program, and if you got the short straw in terms of a genetic profile, you can have still really bad cholesterol. It's very highly genetically influenced.
Well, thank you. I guess here's a caller from Duluth would like to know, Dr. Conniff, the patient has HDL and LDL cholesterols are good, triglycerides are good, but the overall cholesterol is still over 200. Why is that, or is that something to worry about?
Yeah, that's a good question. I think in general we are moving a little bit away from thinking too much about the absolute importance of any one of those numbers, and instead these days when we're trying to figure out what it means, what these lab results mean for a specific person, what we're doing is actually entering them into a calculator that comes up with a suggestion of heart disease or arterial disease risk down the road. Oh. And so what I would generally say to somebody like that is that if when all those different numbers are plugged into that calculator and the risk comes out low for that person's age, then I would say don't worry too much about that one number. Yeah.
Okay, so age enters into it too then.
Yep, exactly.
Okay. Very good. Well, Dr. Wald, he was talking about a calculator. Is that something that's just like an app on your phone, or is it on the computers, or on your computer at work, or is just readily available, right?
Exactly. During our normal visit in the clinic, we can pull up on the screen what's called a statin decision aid, and there are a number of them, but they use a couple different databases that have a lot of patient information. You enter age, sex, cholesterol level, and smoker, non-smoker, history of hypertension. There are a number of important parameters that are predictors, and it'll give you a 10-year risk, and then it can give you a 10-year risk with a statin and without a statin. And a lot of these calculators actually give you screens where it'll show 100 people who take a statin and 100 people who don't, and it'll show you the red dots of people that might have had a heart attack or even death had they decided to take had they decided not to take a statin.
Thank you. Dr. Heron, a caller from Duluth. We're going to be talking about statins, of course, but she would like to know, first of all, is there something that you can do in which you don't have to take a statin? Are there natural alternatives or things you can get over the counter?
Very good question. An answer like, it depends. If you have a mildly elevated cholesterol, if your LDL is mildly up, if you eat a good diet, if you take red yeast rice, which is a natural statin, or a lot of fiber, there are things that will mildly increase your HDL and mildly decrease your bad cholesterol. If you have a significant change you want to make in your cholesterol, if your ratio of bad to good is really bad, statins are the most effective and far outweigh any lifestyle or natural changes that you can do.
Thank you. Dr. Conniff, a caller would like to know about, does cholesterol medicine help with dementia? Or is there a relationship there?
Yeah, that's another really good question. And I haven't dived deep into that, the science behind that recently. I think that there are a couple of different possible answers to that question. Overall, a lot of dementia is related to that kind of chronic arterial disease building up over time, right? Little tiny bits of damage to the brain that happen, accumulating over time that you don't even notice as they happen. So, in theory, having better cholesterol, healthier arteries can help, prevent some of that dementia. At the same time, there are some studies that have suggested that that actually the statin medicines themselves might have a negative impact on cognitive function. So, there's that balance there that there's not necessarily a clear answer to that one.
Okay. Well, thank you. Dr. Wall, a caller from northern Wisconsin, would like to know, well, first of all, can you take niacin and lipitor at the same time? And now niacin, you can get that over the counter, right? Do anything?
Yes. So lipitor, atorvastatin is one of the best studied statins and one of the most potent statins. And it's one of the drugs that have been universally recommended for anybody with heart disease or risk factors for heart disease. Taking niacin, nicotinic acid, which can raise your good cholesterol, your high-density lipoprotein, should be okay. But I think the question that I would have for this caller is the evidence that there's any long-term benefit to taking nicotinic acid or niacin. I don't know that it actually makes you live longer or has any beneficial outcome. As Dr. Conf mentioned, I haven't reviewed the science behind that, but my latest, sort of surface is that, take it if it's working for you, but there's no solid evidence that it's going to.
So it may improve your numbers, but it may not really mean anything
It might,
in the long
it might
term.
make your numbers look better, but does it actually make you live longer? And we don't know, but it doesn't look like right now, no.
Thank you. Dr. Heron, a caller from Duluth would like to know, she had a full hysterectomy, which I assume would mean the ovaries were taken also. Is there a concern regarding cholesterol levels changing now because of the hormone changes?
A little bit. Women tend to have an advantage when their estrogen levels are higher. Everything's individual. She needs to go and have things followed up with her regular doctor and see what happens for her.
Thank you. I have a caller from Moose Lake. Dr. Conniff calls and says, my cholesterols are running under 200. Now, if he quits his statins, what could happen? And if you're another caller would say, do I have to be on statins the rest of my life? Would be the other question.
Yeah. Oh, both of those are really good questions. So I think, as in so many of these answers, it kind of depends. So, it sounds like his cholesterol is, where it should be on a statin. So in some ways, the answer to that question depends on what his cholesterol level changes to after stopping the statin. So going back to that risk calculator that we were talking about before, if he were to stop a statin and then have his cholesterol levels rechecked in 3 months, and those numbers suggested, that they were still pretty good, and his, depending on, because the calculator includes your age and other risks, risk factors, his risk, was still under a certain percentage, then I would say, well, it looks like you're doing pretty well off that statin for now, and for the time being, we can keep an eye on your lipid levels, and maybe you can stay off that statin for a period of time after this. Related to the how long, whether the rest of your life or not, usually we think about these statins as like a risk-reducing medication. So we continue somebody on a statin for as long as there's likely to be a benefit in long-term risk of heart disease, like way, significantly down the road. So that means that for a lot of people, as they get older, the benefit of that way down the road risk gets less and less and less.
Sure. So if you're in your 90s, at that point, it may not be worthwhile taking it anymore.
Yep. And even
you've already had the maximum benefit of it.
Exactly. Even
Sure.
before that, the data is out a little bit, and the guidelines vary on what to do when you pass age 75.
Okay.
Yeah.
Thank you. Interesting. So there's a caller from Drummond, Wisconsin. When you're taking a statin, is there anything else you can do to help it work better, or are there things that you could do that would make it not be as effective?
Statins work pretty independent of, there are some genetic changes that individual to a person that may make one statin work better for them versus another. Those are rare and not well studied. As far as we're all family medicine physicians, so we naturally would look at the whole patient, and a statin is part of a risk reduction program, and the best thing to do would be to improve your diet, to exercise at least 150 minutes per week, which we all know is a challenge, and to make behavioral changes. If you smoke, stop. If you if you are sedentary, move. We know that not moving raises your cardiovascular risk. So I think the most effective way to augment the efficacy of a statin is through lifestyle change. Now, there are a couple other drugs on the market that will lower your LDL further, but I don't think there's real convincing evidence that combining these with a statin has made people live longer or better thus far.
Thank you. Thank you. Dr. Heron, we've been talking a lot about statins. So are statins safe? They're pretty, as far as medications go, are they looked down as pretty safe medications?
Statistically, yes. There are recommendations. If you have diabetes, you're supposed to be on a statin, just because there's some large studies that show you will live longer. There's been some trials done with people who have high risk of heart disease and stroke. Again, statistically speaking, people who take statins live longer, have fewer heart attacks, have fewer strokes. That's considered safe for most part. Now, when you get to an individual level, some people tolerate them much better than others. Doses, lower doses, higher doses. There may be more side effects associated with some medications than others, more side effects associated with higher doses, like maybe higher blood sugars at higher doses. So it's hard to generalize statins as a whole class are beneficial. When you break it down to an individual person and an individual statin, you have to look at that situation. But if you go by the vast majority of the evidence, they're safe and effective.
Great. Thank you. Dr. Khan, if I have a caller from Duluth, would like to know, is there a correlation between statins and blood sugar levels or the A1C?
Yeah, it's a good question. I think that there, as Dr. Heron was just sort of mentioning, there is some slight risk of increased blood sugars on some high doses of statins. At the same time, I think the takeaway message from that is that, just like Dr. Heron was saying, what statins do overall, and especially so for people with diabetes, is lower heart disease risk down the road. And so, so usually when I'm talking to people about that particular concern, I say, well, they may actually have some slight effect on the blood sugars and the A1C, but their long-term benefit is likely to be good.
Great. Thank you. Well, some more questions coming in from our callers. Dr. Wald, a caller from Duluth would like to know, does it matter when in the day you take a statin?
Excellent, excellent question. Traditionally, we've always recommended that you take a statin at bedtime, and there may be some physiologic benefit, but a lot of it is to minimize any. Statins have been associated with some myalgias, which means muscle aches, and so if you're asleep, you are much less likely to be aware of those and to have any issues that might make you want to stop the statin and therefore miss out on the health benefits.
Thank you. Dr. Heron, here's a good question from John. It doesn't say where he's from, but John would like to know, does fish oil have any benefits regarding cholesterol or triglycerides?
Especially triglycerides. There have been some studies that in large doses, fish oil can lower triglycerides. Again, in terms of the long-term reduction in bad things. I mean, that's why you want to lower cholesterol. If having high cholesterol didn't do anything bad to you, who would care? You don't care if you have a high cholesterol, you just care if you have a heart attack or stroke or drop dead. So fish oil will lower triglycerides, which also is related to pancreatitis, which is another bad thing. It has to be good quality fish oil, and that with some of the over-the-counter ones can get hard because the labeling isn't good. The quality control in over-the-counter medication is not good. You can get expensive prescription fish oil, which is not very well covered. And it is most specifically for the triglycerides, for the people who have the hereditary problem, especially who have tremendously high triglycerides that can't be managed by diet.
Well, thank you. We have a caller from Barnum who would like to know, Dr. Conniff, speaking of some other things, how about garlic and how about coenzyme Q10?
So two different reasons for taking each of those. So some studies have shown that garlic has a positive effect on cholesterol levels. Just kind of like fish oil, the way I think of garlic, grapes, other sorts of foods and nutrition sources that have a cholesterol lowering effect. I think it tends to work best as part of like Dr. Wall was saying earlier, as part of a whole healthy diet. I think the Mediterranean diet, I think, is the best studied diet that overall kind of prevents heart disease and the kind of problems, the reasons that we treat cholesterol. So I think, a very garlicky diet is a great idea for a healthy diet.
You may not have many friends.
You might lose some friends, yeah. But if you kind of get your friends all on board with eating a lot, maybe you can have a garlic party.
Okay,
yeah, exactly.
Well, that's good.
And then coenzyme Q10, that's something that we take to mitigate or recommend sometimes to our patients to reduce some of the side effects of that Dr. Wall was talking about of statins. And it hasn't been there haven't been a ton of studies out there, but a lot of people do benefit. So I recommend that if somebody's having some of those bothersome but not otherwise concerning side effects of statins.
Okay, well, thank you. Interesting. Dr. Wall, Gregory calling from Duluth. He's on lipitor or atorvastatin, 40 milligrams a day. Some of his friends take a lot less than that. Some take more. How do you come up with the dosage? Is 40 a lot? Is 80 a lot? Is 10? What? Where do we go?
It's a really insightful question, because in 2003, one of the guiding organizations, the American College of Cardiology, American Heart Association, came out with some new guidelines. And these guidelines were really a sea change in how we managed cholesterol. And they essentially put people into 4 boxes and said, if you're in this box, then you take this dose. If you're in this box, you take this dose. And so anybody who has had any sort of prior heart condition, heart attack, stent placement, they need to be on a high-dose statin. And there were essentially 2 high-dose statins, atorvastatin and rosuvastatin. And high-dose atorvastatin is 40 to 80. And so this gentleman, if he has a colleague who, has their physician plug them into a risk calculator, they have a significant risk for heart disease, recommend a statin, but they fall into a different category that's moderate risk, then they might only take 10 or 20 milligrams of atorvastatin. So, and it's better to be on a statin if you have risk factors, be on any statin at any dose versus no statin.
Thank you. Dr. Heron, a caller from Ashland would like to know, what do you recommend for people who have reactions to statins, like muscle aches and that?
That is a very common thing I deal with all the time. The recommendation is all statins are not created equal. If you have problems with one, try another. If you have problems with that one, try another. There are several of them to go through. Also, you don't need the highest dose. You can start with the lowest dose. For the people I have who are extremely sensitive, I tell them to start with 1 pill a week. Start with a very low dose, even a half a pill, once a week. Most people can tolerate that. If they can do with their half a pill once a week, do that for a couple months. Now, maybe your half a pill twice a week. Find what dose they can take, because anything is better than nothing.
Well, thank you. We have a caller, Dr. Cummins, a caller from a caller from White Lakes would like to know, and this is a question I was going to ask, why can't you drink grapefruit juice? with the statins. What's that all about?
You can drink grapefruit juice
Yep.
with statins.
Yep, I would say you can drink, exactly, you can drink grapefruit juice with statins. There is some, discussion out there about the way the liver breaks down statins, but basically I wouldn't worry about it too much. If you like grapefruit juice, it's a healthy thing to drink and you should drink it.
And finally, we just have about a minute left, but we have a caller, Dr. Wall, we have a caller from Bowabic would like to know about cod liver oil. Where is that in all of this discussion? That's an old-fashioned thing, but does that have a role in any of this?
Certainly, and excellent question, because it kind of speaks to what Dr. Heron answered earlier, in that fish oil, there are omega-3, omega-6. 10 years ago, there was a lot of attention given to fish oil that it might actually make you live longer. Now there are certainly some antioxidant effects, some health effects, but we're not finding that it is necessarily making you live longer. So go ahead and take it if it's working.
Okay. Well, thank you very much. Sorry to cut you off, but we're out of time. I want to thank our panelists, Dr. James Konoff, Dr. Victoria Heron, and Dr. Jason Wall, and our medical student volunteers, Brandy Bolig, Luke Logerin, and Sarah Reyna. Please join me again next week for a program on skin problems, when my panelists will be Dr. Patrick Brown, Dr. Lisa Prusak, and Dr. Hilary Reich. Thank you for watching, and good night.